Good morning, everybody. As at 8 p.m. last night, there were 10 cases of community transmission in New South Wales. 9 of those you'd already been made aware of yesterday. The 10th one is an additional person that attended that party where the worker from Bondi Junction also attended. So they are the 10 cases to 8 p.m. last night. Unfortunately, since 8 p.m. last night, New South Wales has recorded an additional 13 cases of community transmission, 8 of which were at that same party. So yesterday we mentioned a party which was attended by a worker from Bondi Junction. That party had an additional case to 8 p.m. last night and 8 additional cases from 8 p.m. till now. The 9th person out of that 13 was a patient in the waiting room of the case that we mentioned yesterday, and there are 4 cases under investigation, but all are in close proximity to the southeast Sydney cluster, and Dr. Chant will provide further detail on those. Clearly this is an evolving situation we would have preferred not occurred, but given what has occurred, the New South Wales Government will be taking action today to limit the spread of what is a very contagious variant of COVID. I do want to firstly thank the more than 44,000 people that were tested at 8 p.m. last night. That is a good result. We've jumped up from 28,000 the previous day, and I want to thank everybody for listening to the messages, for isolating when they had to, and I also want to take this opportunity to thank our contact tracers. Can I say that our contact tracing has been outstanding, and the contact tracing is not the reason why we'll be imposing additional restrictions. It's because this variant of COVID is causing transmission in very fleeting exchanges, and obviously given the number of people who've been in isolation or otherwise who've contracted the disease means we need to take further action. So from 4 p.m. today, well, obviously we want to make these restrictions immediate. So if you're able to apply these restrictions, do so immediately, but obviously compliance will be happening from 4 p.m. today. The following restrictions apply to everybody living in Sydney, Blue Mountains, Central Coast, Wollongong and Shellharbour. Importantly, we don't want more than 5 visitors to any household. That includes children. So please don't welcome any more than 5 visitors into your household, including children. We know it's a difficult time given school holidays. And I should also say at the outset that these restrictions that we're announcing today will be in place from 4 p.m. today for an additional week. So obviously we had said that the mask wearing restrictions had to be in place for another week until Wednesday midnight. This will now apply to these restrictions that I'm announcing today. So no more than 5 visitors per household, including children. At hospitality venues, no vertical consumption. All people must be seated wherever you are at any setting. We do not want mingling. Mingling will mean transferring the virus. So please make sure all consumption at hospitality venues or otherwise or at events has to be seated and with good social distancing. Now obviously no singing or dancing at any venue except for weddings, which we will allow 20 people on the dance floor at any given time. But no dancing or singing, whether it's a place of worship, whether it's a nightclub, whether it's anywhere else, but for weddings. So clearly no more than 20 people on the dance floor at a wedding. We will be reverting to the 1 per 4 square metre rule during this time, and we know that will have an impact on family gatherings like funerals or weddings, but these are the measures we have to take charge of now so that we don't have to do anything more severe down the track. So what we're putting in place now is in a bid to prevent us having to take further action. Now if there's a major outdoor event like a sporting event or another organised event, we will be recommending only 50% capacity. So if there's a stadium where there's a major event on over the weekend or in the next week, we're recommending only 50% capacity, and that will be in the health orders. We also want to make sure that there's more wide mask wearing. So obviously if you're at any indoor setting, including a workplace, including Parliament House, except if you're speaking, you should be wearing a mask. So we are going to extend mask wearing to indoor settings like workplaces, and we already had them in place for a number of venues which we announced yesterday. Now if you're going to an organised event, like an outdoor sporting event or an outdoor concert or some type of other event, in addition to the 50% capacity, we also want you to wear a mask at those events. So if you're going to a sporting event, there's likely to be cheering and shouting and whatever else, given how contagious the virus is, we want you to be wearing a mask at those events. Also, obviously the exception is if you're eating or drinking, and that's applied throughout. Now, gym classes will be limited to 20 people, but you do have to wear a mask. So some people might choose not to attend those gym classes. We want to not have a bigger impact than we need to, but gym classes are limited to 20 and you must wear a mask. And as for public transport, it's back to the green dots. So the green dots are still there. We kept them in place, fortunately, so make sure you're wearing a mask on public transport and make sure you wear those green dots. Now, importantly, if you live or work in those 7 LGAs that we had described earlier in the week, so I don't live in one of those LGAs, but I work in one of those LGAs, you cannot travel beyond metropolitan Sydney. So if you live or work in those 7 LGAs, which includes all of us, you cannot travel outside metropolitan Sydney, unless it's essential. So unless you're going to visit a relative in care, or unless you have to go for work. So unless it's essential travel, you should not be going outside metropolitan Sydney for the next week. And we apologise in advance that this does impact some people's ability to travel during the school holidays. But these measures mean that we don't have to go further at this stage. So we're not going to restrict people's movement or what they do, but we are going to restrict, if you live or work in those 7 LGAs, you shouldn't go beyond metropolitan Sydney unless it's absolutely essential. Now these, as I said, these changes or restrictions will be made effective immediately with compliance from 4 p.m. and I appreciate there may be categories or specific areas we haven't covered in this press conference. Please follow the health orders. What is really important at this stage is for all of our citizens to be aware of the basic things we've put in place, and we trust our citizens to follow everything we've put in place, and we also trust people to exercise common sense. Please abandon non-essential activities. Please don't attend social gatherings unless you absolutely have to. We appreciate that beyond these health orders, people might treat their vulnerable friends and family even more strictly than what we've advocated. But we also, please, essentially in the next week, we don't want people moving around unless it's essential. But obviously, we are advocating at the same time, you can attend hospitality venues, you can do all those things you have in place, but these rules, these stringent rules will be in place to make sure we prevent the spread of the virus. And as I said, on this occasion, our contact tracing has been better than I've ever seen. But what we haven't seen before is the contagiousness of this variant of the virus. It is extremely contagious, and the fleeting exchanges, not even physical touching, has meant people have transferred the virus. So I'll ask Dr. Chant now to go through the specifics of the cases I outlined, and then Minister Hazzard will make some comments, and then we'll take questions. But can I please stress that's important for our citizens to get these basic messages. If there are specific categories or situations we haven't covered in this press conference, they will be covered by the health orders at 4 p.m. But I think people get the general message about what we're advocating at this stage. So if you're going to work in your workplace, even if it's indoors, wear a mask. If you're going to an outdoor organised event, we will want you to wear a mask. But obviously, if you're just walking, if you're in your car or you're just walking down the street or getting exercise, that's not required for those situations. So Dr. Chant will now go through the various cases on top of what I've outlined. Minister Hazzard will make some comments, and then we'll open it up to questions. Thank you.
So I might just take you through as a recap of the cases over the last day, and also describe some of the issues that are causing us concern at the moment. So there were 10 locally acquired cases to 8 p.m. last night, and there were 3 new cases. So the vast majority of those cases yesterday were pleasingly in isolation for the full infectious period. However, we've had 2 cases yesterday that were not. So that was the 9-year-old child that attends the St Charles Catholic Primary School, and also we've had a gentleman in his 30s, and he attended the birthday party. In terms of the cases today, we had 13 locally acquired cases were reported after the 8 p.m. cut-off last night. 8 of these cases were linked to the birthday party in West Hoxton, attended by the previously reported case, so the worker at Bondi Junction. So just to describe the sequence of events so you can understand how quickly transmission is occurring. That party and gathering occurred, there were about 30 people in that gathering in a house. The person was obviously infectious at the time, unknowingly, did not have symptoms at that time, was unaware, had not attended any venues. In that evening, then went and got tested when they developed symptoms the next day, and we got the result on the Monday. Immediately people were asked to isolate, and then we've got the tests that have been coming in associated with that. And what you can see is that those test results indicate how rapidly the virus was transmitted in that circumstance. We've got 10 cases from that party, and that's on day two after the exposure. So the event happened on Monday, and those individuals were tested on Tuesday. And remember, there is a period where they would not have been infectious on the Sunday, but all of those individuals would have unknowingly had the infection for periods of Monday, and that's why contact tracing is occurring related to a number of their movements. In addition, we've had one close contact of another previously known case, and that person's been in isolation for the full period. But then we've also had 4 overnight cases that we are urgently investigating. We know that all either reside or work in the southeastern Sydney area, so that does give us some comfort about the geographical spread of it. But what it means is that there is clearly cases that have been unrecognised in that area. And I know the symptoms of COVID can be incredibly mild, and some people can be asymptomatic, and hence we've wanted to call out and get those high testing numbers. Can I thank everyone for those high testing numbers? That's been essential. And if we were to get on top of this outbreak, though, maintaining those high testing numbers is going to be critical, as well as in following the public health orders. I just wanted to reiterate some advice, particularly in relation to Westfield's Bondi Junction. We've asked anyone who has attended from the 12th to the 18th of June to get tested, and we're specific, and that includes the car park, and particularly at the Fitness First there at any time between the 12th of June and 18th of June to get tested for COVID. It is critical. We have had a case that has frequented that facility, and it is important that we detect any crossover that may have occurred there given the nature of the transmission. There's also, New South Wales Health is asking anyone who attended the Wallabies Thai restaurant in Mascot between the 19th of June, between 11:30am and 12pm, sitting inside or outside, to please ring the contact tracing on 1800 943 553. If we could also ask people to isolate whilst they're getting onto the contact tracers, so they can get the specific advice related to their circumstances. So in summary, we've moved from having our cases all in isolation to unlinked cases. So in relation to the 9-year-old child, to date, we have not identified a source, but testing is underway. So it's not the usual source that could have been a household contact at this stage, or other household members have tested negative. So our investigations into that case are continuing. So the cause for concern is that we have had people infectious in the community unknowingly. The parties obviously led to a number of infections, but can I thank the response in southwestern Sydney, cooperation of those businesses impacted, and we're confident that if people could be alert to the website, we can bring that risk and threat under control. Our major focus is in this southeastern Sydney broad area, including the CBD, to make sure that we have picked up any unrecognised transmission. There's obviously been some strains of transmission that have had the ability to amplify, and we need those high testing rates and everyone to follow the public health advice. Thank you.
Thanks, Dr. Janet. Last Saturday, I indicated that what we knew about this Delta virus and the transmission at Westfield at Bondi Junction could be described as a near and present danger when we were in the vicinity of the virus. I think now what we've seen just in the last week or so is the numbers have gone from basically our first case to more than 30 cases very quickly. And obviously you just heard that we've had 13 cases since 8 p.m. last night. What I would say to our community is we've gone from that near and present danger to a very real and present danger, not just in a shopping centre, but right across Sydney. We need to all take this seriously. We each have the future of our fellow New South Wales residents and our Sydney residents in our own hands. The mask wearing has been stepped up dramatically, and that's for good reason. There should be no reluctance to wear masks in all of the circumstances that have now been described. Wearing masks at work will be different, but necessary. Wearing masks when you go to the footy or some of these other outdoor events, I know the temptation will be to sit there with a mineral water or a beer and say, well, I don't have to wear the mask and I can make this last for the whole game. If you do, you're putting the entire community's health at risk. This is no time for game playing, it's no time for stupidity. This is a very serious situation that we are now in. This Delta virus has shown itself to be very capable of spreading extremely quickly and in circumstances that New South Wales residents really haven't experienced in the same way before. Now, this is a proportionate and sensible response, but it will only work if the community actually are on board with us and make sure that you listen to the messages, you use the masks, and more particularly, or equally particularly, use the QR codes. Now, I know from my experience that, and from others' experience, that there's a degree of tiredness, a degree of apathy about the response to the virus. But in a sense, this is a new and more dangerous version of the virus, and that apathy has to be swept away. We have to actually take it seriously. The QR codes should be used whenever you're entering any of the various spaces where there will be QR codes. And you should make sure that if you don't happen to have a QR code, if you happen to have an older style phone, and I know there are a lot of older citizens in New South Wales who don't have data on their phones, what I would say is to the various hospitality providers, shopkeepers and others, make sure you have alternative methods of knowing who has been in your shop. It may make a difference to all of us to know that one person who came in and left and with this particular Delta variant. So every retailer, every hospitality centre, every opportunity where one of our citizens is going to be entering into your premises, make sure you have the QR code visible, make sure you're checking as far as is humanly possible to get everybody to sign in on the QR code. But if they haven't, if they happen to not have a data phone, then make sure there is written capacity, paper and pen. It's that simple. Just make sure that you've got that ready and available. And again, we're all in this together. It is quite serious. I have to say, as the New South Wales Health Minister, I'm as worried right now as I have been at any time since January last year. So we need to make sure we're all looking after each other.
Samuel, what's the definition of metropolitan Sydney, and what do people do if they live outside of metropolitan Sydney but work in one of these impacted LGAs?
Well, if you live or work in any of those impacted LGAs, we don't want you moving outside of metropolitan Sydney, but obviously, unless it's for essential purposes, and obviously work, visiting an ill relative or essential service purposes. So can I please make this important point? I think people get the general message when we say, if you live or work within those LGAs, we don't want you travelling outside of Sydney. If you happen to come from outside of Sydney into those LGAs, we recommend you don't in the next week. So this comes down to our health orders, but also exercising common sense. We know the virus is circulating in particular around those LGAs. The unlinked cases, or those cases that are under investigation, are all in that or from that geographic proximity. So this is important and proportionate action we're taking to prevent further spread. Having said that, we're not limiting people's behaviour within metropolitan Sydney. The risks are there, so we're not saying you can't leave the home for any reason, but we're saying when you do leave your home, There are now things, there are now rules you have to adhere to. We're not saying you can't leave your home for any reason in metropolitan Sydney. You can. We're not putting any objections on you leaving the home for any purpose. But if you happen to live or work in those 7 LGAs, we don't want you moving outside of Sydney. We don't want the virus to spread into our regions. We don't want the virus to spread into holiday destinations within New South Wales, regional New South Wales in particular. And I think the vast majority of the public understand that.
Can you please explain what metropolitan Sydney means? What is
Well, I think most people know what metropolitan Sydney means.
Alright,
Well,
right,
obviously we've said that the restrictions I've announced today apply to Sydney, they apply to the Central Coast, they apply to Wollongong and Shellharbour and the Blue Mountains. But in relation to those travel restrictions, if you live or work in those 7 LGAs, don't go beyond metropolitan Sydney. I think most people know what that means.
What if you work in one of these LGAs, but you live in the Blue Mountains, or you live on the Central Coast? Should you
Well,
come
that's
into
why
work
we've
in
said.
one of
Well,
these
that's why
LGAs?
we've said you assess your own situation, but we don't want people who are living and or working in those LGAs to spread, to move around. So if you happen to work in a regional community but travel to those LGAs, we recommend you consider working from home or else living in the LGA where you work. But for essential purposes, people can still conduct their business. You just have to be extra cautious. If it's for an essential reason, you're able to move around. But what we are saying is if you live or work in those LGAs, we do not want you moving outside of metropolitan Sydney. Now
Are weddings and funerals essential?
Weddings and funerals, we appreciate the pressures on families, and that's why we've put restrictions in place. It's 1 per 4 square metre rule, mask wearing obviously for funerals, for weddings no more than 20 people dancing. So we again ask people to follow the health orders, but in this instance we're making it very clear that we don't want wedding parties to have any more than 1 per 4 square metre rule. We're not suggesting cancelling those events, but we are suggesting massively toning them down to make sure there isn't a spread. At the end of the day, people also need to rely on their common sense. Nobody wants those closest to them, their loved ones, their friends and families, to be exposed, especially vulnerable family members, to be exposed to the virus. So we ask people to make individual decisions on their own circumstances. We've put these rules in place. There'll always be exceptions. There'll always be certain situations which perhaps every single health order doesn't cover. We rely on people's common sense as much as what the health orders say. That's been our approach from the beginning, and we especially need people to follow that approach.
The Health Minister has just said that there's no time for game playing, that everyone needs to take this really seriously now. Why won't you consider a lockdown at this point?
Because we've always said, and we've considered all the options, but we've always said we won't burden our citizens unless we absolutely have to. We know basically where the super spreading events have been. We know where the virus is circulating. And look, we don't want to take any further action than what we have now, but this relies on all of us reining in our behaviour, all of us following the health orders that are coming into place from 4 p.m. I'm not ruling out any further action, but I'm also confident that if we adhere to the health orders today, we will have a good chance in getting on top of this outbreak. Now, I'm not going to rule out further action. I'm not going to rule out what happens beyond a week, because we don't know. We certainly didn't expect this situation a few days ago. But that's what it means. Responding to a pandemic means you look at the facts, you look at the response, you look at where spread is or isn't occurring, and you respond accordingly. We've always had the approach in New South Wales not to burden our citizens unless we absolutely have to. We've listened to the health advice, we've listened to what's occurred and what's occurring, and based on that advice is what we're announcing today. But if we need to take further action within the week or after the week, we're open to that.
Premier,
But we just don't know yet, because the situation is evolving.
Premier, was it an error not to require anyone who attended Bondi Junction to isolate after testing?
Well, look, we rely on the health advice, and Dr. Chan, did you want to answer that question?
Yeah.
We'd given significant recommendations of a broad number of people required to isolate. I have to look at where people have moved, but a number of the cases have been exposed in different settings in Bondi Junction. Obviously, it's a pragmatic thing of making sure there's no barriers to getting testing. So these are all complex weight decisions. We asked people to minimise movements. We asked people that if they could isolate, but could they not go to a restaurant, other activities, minimise their movements. we, as the Premier had indicated, we really require people to be on this journey with us, and ultimately our response is, yes, we can make orders, but we do need to work and explain to the community why we really need them to take the action that we're required, because in the end we can have orders, but what we need is compliance with them. So can I thank, for me, seeing those numbers of testing numbers jump up, I'm really grateful that so many people went out and got tested. What I need to see is those testing numbers maintained so that we can actually identify any of those unrecognised chains of transmission and lock down any people both upstream and downstream trains to reduce that burden of transmission.
In relation to cases, Doctor, there's been reports this morning of the Narellan Vale preschool having to close.
Yes.
Does that
that's related to the so the person who attended the birthday party. So there was as I indicated, there were a number of cases, 10 associated with the birthday party. There is a particular family that a number of members of that family tested positive overnight. They're included in the numbers. One of those was a child that did attend that childcare centre. The public health unit followed up with the childcare centre, and can I just thank the childcare centre for their prompt response in communicating that to parents. And I believe that we also, public health, texted parents last night in relation to that event. So that goes to the point I raised earlier, which was the fact that we had this party. Can I just say that the person attending the party was not symptomatic, had no indication, promptly went for testing. We got to this group very quickly, and that meant that they were basically infectious in the community for one day, probably, given that it takes about 24 hours to incubate and their exposure was a Saturday night. So we're looking at, but unfortunately 10 people have tested positive after a family gathering by the Tuesday.
Was it a children's birthday party or an adult's birthday party?
Look, I'm not sure of the specifics. It was a mixed age group, and can I just applaud the cooperation that group has undertaken. All of them promptly went and got tested. All of them promptly isolated. So from them knowing they were a risk, we were able to do that. And that's why getting tested, keeping an eye on your phone, making sure that you're accessible, following the public health advice. These are all elements, because missing one of those chains, you could see that if this person had not tested, how quickly that could have amplified in an area that is outside the area where we know the predominant transmission's occurring. So for me, I'm just express my gratitude to everyone who is rocking up for a test. Please continue to do so. It's critical.
Would you call
As a 9-year-old then sequence, the genetically sequenced?
The test result was yesterday. I'll check, but sequences are quick, but they're probably...
is the same as the
I would expect that all of these are the same, but as you know, we do sequence them just because we don't keep any closed mind, but geographically this school is located in a setting close to where we're seeing transmission. But as I said, never say never in COVID. We will get the sequencing in due course.
Can I just ask, can we just take a step back a bit? With the vaccination rollout now, I think it's almost more than 70% of people over the age of 75, our most vulnerable, are now vaccinated. Does that come into your calculation when you're making decisions like this, when you're putting significant restrictions on people's lives, when the people that the virus will affect the most are protected from it?
Well, firstly, we don't have sufficient vaccination to distinguish between those that have been vaccinated and those that haven't. This particular strain of the virus is extremely contagious, and we don't have enough of the population vaccinated to be able to make those distinctions. If we had a higher proportion of the population vaccinated, we perhaps could have considered that, but we're nowhere near that point. And having said that, this strain of the virus is contagious, and it's rather random as to how you're impacted by it. You could be a younger person and suffer very serious health consequences or death. It is random. It's not just older and vulnerable people that may be susceptible to very serious consequences or lifelong consequences. That's why it's really important for all of us to protect those around us, people we work with, people who are our closest family and friends. And also, unfortunately, we have to consider random members of the public. Brushing alongside somebody can transfer the virus. That's how contagious it is.
What is the threshold then? When can we put all this behind us in terms of the rollout? What's the
Well,
threshold?
well, the New South Wales government went out on a limb. I personally went out on a limb quite a significant number of weeks ago and said until we get 10 million jabs in New South Wales, we can't have these conversations. We're at nearly 2 million jabs, so we're about getting 20% to where my target is in terms of where we can have these conversations, and that's why we do have a sense of urgency about the vaccine rollout. That's why it's so important for those who have access to the vaccine to please go get vaccinated. Especially, can I reiterate, if you've had a first jab of the AstraZeneca, please go and get your second jab. That is, and if you have any issues, you can consult your GP. But if you've had the first jab of the AstraZeneca, please have your second jab. And that especially applies to people over 60 years of age.
Premier,
Is
the
it true that
building
New
we're
South
standing in-
Wales will be increasing their Pfizer supplies next month?
Well, we can't increase those supplies. Their supplies, the federal government provides all the states. What they've said about New South Wales applies to all of Australia, so we're no special case. At the National Cabinet meeting, we were advised of the doses we're likely to receive in the next little while. Those doses are based on head of population, and New South Wales will be getting its fair share.
Premier,
The building we're
sorry.
standing in has MPs from
I'm
all
sorry, I didn't get the first
Sorry,
one.
the building we're standing in has MPs and representatives from all over the state. Should regional MPs and their staff go home given the new restrictions, and seeing as there are 4 national MPs in isolation, should New South Wales Parliament be suspended?
Well, we can't make ourselves an exception. I mean, we are a workplace as is everywhere else. So obviously, for essential purposes, people can go to work, but they must wear masks, including in this workplace. And obviously, at the end of the 2-day sitting, I expect once regional MPs go home, they will stay home, because we're asking people not to engage in those 7 LGAs in particular unless you have to. If you're already in those LGAs, you live and work in those LGAs, obviously you move around. But we just also exercise common sense. This workplace is no different to many others. People will have these questions. Essential work is okay. Visiting for compassionate care or supporting loved ones is okay. But we ask everybody to be extra cautious and extra sensible. When you are at your workplace, even if it's indoors, you'll be required to wear a mask, and that applies here.
If
Premier,
regional
yesterday-
MPs go home,
Premier,
then,
yesterday, it's only less than 24 hours ago, handed down a budget which was largely predicated, and even the budget papers said, you know, assuming that we won't have to return to restrictions like the 4 square metre rule and restrictions on weddings. What does this mean for the future of the budget? Are you worried about the impacts it's going to have?
No, I think what we have to assume is until the vast majority of our population is vaccinated, what we're experiencing now is a threat. We've been down this path before. We've had restrictions imposed before, and what this does is provide us with a timely reminder that the pandemic is real and it's ongoing. And that's why New South Wales has had a real sense of urgency in relation to the vaccine rollout. Until the vast majority of our population is vaccinated, these threats will be real and ongoing. And no matter how good we are at dealing with the outbreaks, and this one is still ongoing, the threat is real until the majority of our population is
on
vaccinated.
the current rate,
on the budget.
on the
So you
current
don't-
rate of vaccinations, though, you're looking at 2 years. I know 2 million sounds good, but it's been 6 months. Like, when are we going to see a ramp up to the point where we can have the conversation about let's just let it go?
Well, that's why we've said, New South Wales has said, we can have these conversations once we have 10 million jabs.
And when is that?
The
When are you
New,
looking
well,
at that?
the New South Wales government can control a number of things in relation to the pandemic. One thing we don't have any control over is the number of doses we receive and what those doses are. Now, that is the responsibility of the Commonwealth Government, and they're just the facts. I can't control how many doses New South Wales receives, but I can make sure that we support the efforts of the Commonwealth, which we have. If it wasn't for us advocating that, we're doing around 100,000 through New South Wales Health every week. But we're also calling on the Commonwealth to increase the number of GPs that are allowed to provide those vaccines, because we want to see that ramped up. But today, can I just focus on the fact that I just want everybody in New South Wales to be aware of what we're putting in place for the next week at least. And please know that this is a serious, as the Minister for Health said, as Dr. Chand has reiterated, we are in the midst of a very serious outbreak of a very contagious variant of the virus. We are assuming a position which places restrictions on our citizens, but a restriction regime which is proportionate to the risk at this stage, but that could change. We just ask everybody to be alert, to keep looking at the health websites, to listen to our alerts, and obviously to listen to the advice that we provide on a daily basis, and that is critical. But we are also relying on people's common sense. There'll always be exceptions. There'll always be situations which the health orders can't consider the literally thousands of variations that could exist. And we rely on people's common sense, knowing what we know, knowing what we've been through in the last 16 months. I'm incredibly proud of the fact that every time we ask our citizens to come forward and get tested, they do. The cooperation we've seen from those who've tested positive has been outstanding in the last few days. And the contact traces this time around on this outbreak are much faster than we were at the previous outbreaks, because we know what we're doing. The QR code system is working well. But what we can't control is how contagious this variant is. And that's why we've put in the restrictions we have.
Premier, given we're on the cusp of school holidays, a lot of people's travel plans to Victoria and Queensland have been cancelled this morning, likely a rush going to regional New South Wales. Should we be telling all Sydney-siders to hold off on those plans, even though we've just got this week travel ban so far?
Well, that's why we're being proportionate to the risk, and we're saying at this stage, if you live or work in those 7 LGAs, and let's face it, that's quite a significant proportion of Sydney. Many people work or live within those LGAs, and that would cover a very huge proportion of Sydney-siders anyway. So we're being realistic, we're also being proportionate to the risk that's there. So if you live or work in those 7 LGAs, please don't travel outside of Sydney. We don't want to contaminate or spread this variant into the regions, and I think regional communities would welcome that move. But we're being proportionate to the risk. But it is an evolving situation. If Dr. Chant and her health experts give us advice during the next week or following the next week, we will absolutely follow that advice. But what we've done in New South Wales is balance the risk, make sure we're not imposing restrictions over and above what we need to. But when we need to act quickly, when we need to act decisively, we have done and we will. And I'd be prepared to make any decision or announcement if the health advice recommended that in the next few days. But at this stage, this is the best advice we have. This is the best response we have. And I just ask our citizens to do what they've done during this entire journey. Is we've trusted them, they've trusted us. And if we need to do further, we will. But we also appreciate the time of year it is, but we also appreciate the risk, and that's why the response we've provided today, we believe, is a good response or a proportionate response to the risk.
Anastasia Palaszczuk this morning has said that she would consider an exemption for Mark Killian to go to Queensland and see his dying father if you write her a letter saying that you allow that exemption to take place. Is that a letter you'll consider writing to the Premier?
At least a week ago, our health minister spoke, and New South Wales made it clear there was no impediment for them to make that journey. And can I be clear on that?
Have you submitted a plan to Queensland Health?
I'm sorry?
Have you submitted a plan to Queensland to get
Well, that's already been aired publicly for the last few days. And Minister Hazzard will correct me, but that was already made clear that we did everything we could to facilitate that.
You need to wear a mask at the gym or in the car.
I'm sorry?
If you're at the gym, you need to wear a mask.
Well, we don't recommend, gym classes cannot happen more than 20, and you have to wear a mask if you're attending a gym class. During the class, yes. But if you're attending a gym, you have to apply to the 4 square metre rule and also the COVID safety plan for that gym. So make sure you wash equipment before and after you use it, make sure you check in, and make sure you follow other safety advice for that gym's COVID safety plan.
No mask on a treadmill.
I'm sorry?
No mask on a treadmill?
No, but you have to make sure that you apply the 4 square metre rule, that you have social distancing, that you apply the COVID safety plan to that gym. If it's a class where people tend to be in close proximity, you do have to wear a mask.
Can I ask the health minister something very quickly? This all started a week ago from one bloke, a hire car driver who wasn't vaccinated. Why wasn't he vaccinated, and have the police gone anywhere with their investigation as to whether he was wearing a mask, and are they going to fine him?
The limousine driver has been very helpful from my perspective, in the sense that he's helped the health team, the tracers, to do all that we needed to do. Anything beyond that in terms of enforcement are matters for the police, and you'd have to direct your comments or questions.
You're squibbing it a bit though.
I'm answering the question, Chris, the way it should be answered.
But in all seriousness, people in Sydney are now having significant impediments put on their lives thanks to one gentleman who was allowed to pick up aircrew while he was not vaccinated. Why wasn't he vaccinated?
I've answered the question, and I've also said that...
Well, why wasn't it? You haven't answered the question.
I've answered the question, and I've said that the police are actually investigating the matter and they'll make their decisions. But I would stress again, the most significant thing, and look, I've had journalists for 15 months, 16 months, at numerous of these press conferences suggesting that somebody should be charged and expecting the health minister to have a role in that. And I've made the point time and time again that we need people to be cooperative. We need them to feel they can tell us everything in terms of our health traces, and that's my concern.
Minister, has the Premier said on the 17th...
Sorry, James. Say it again.
The Premier said on the 17th of February, and I might ask the Premier the same question as well, it's really our intention to have everybody who puts their hand up to work in and around the quarantine system to have the vaccine. This man's put his hand up to work in and around the quarantine system. Why didn't he have a vaccine?
Everybody who works in the quarantine system should be vaccinated, and that's an arrangement that is enforceable. But of course, from time to time, there are people who come in and out of the system, and it's a human system, and there are a range of reasons why we might find that somebody is not vaccinated. It could be a health issue themselves. So those are issues that we need to look at, and the police are investigating. I'm sorry, look, I've already indicated to you, look, you can get as excited as you like about that, but I'm telling you, the police are investigating. We've made that before, so let's concentrate today on what we need to be doing. We're in a 1 in 100 pandemic. We have a serious issue, a Delta variant of the virus. It could have happened at any point, any time, and we've made that point for the last 12 months, 15 months. That it's a human system and we've got to expect.
Can you guarantee
sorry, just
from
hang
now
on,
on
Sue.
that people
Chris,
at the border are vaccinated?
Chris, I'm just going to finish.
Fixed at least.
Chris, I'll finish. We've had almost 200,000 people come through our quarantine system, and at any stage there are human beings at every level working with those incoming passengers, and we have to, from time to time, expect that there will be issues. That's why it's so important that we get everybody vaccinated, but also listen to what we're saying. It's all I'm prepared to say on that matter.
Do you know
Last few questions, please.
Metropolitan Sydney, Minister, do you know the definition of Metropolitan Sydney?
It's exactly what the Premier's just told you, James. You're getting a bit excited about nothing.
Last few
Dr.
questions,
Chair.
please.
Given that there has
Can I
been...
just ask you, can you put it into perspective for people, like, how concerned are you about the rate of spread for this cluster as, say, compared to the northern beaches?
Every cluster has a unique characteristics, and what we saw with the Northern Beaches cluster, it was a super spreader event. That there were 2 different venues that amplified the transmission, and then we were able to get on top of it. We weren't dealing with the Delta variant at that time. What's been particularly concerning is that usually we would have seen retail environments as low risk settings. If you were shopping in a department store, they're generally not crowded places. They're not, when you're walking around, generally people do try and keep some distance. So to see transmission occurring in the setting where the mode of transmission would be inadvertent. Yes, we have captured on CCTV footage, and I don't want to enhance that this virus jumped across the room or anything. We did see some close contact, but it would be the sort of inadvertent contact you'd have it in retail settings, that where we wouldn't have suspected transmission could happen as predictably. Like, yes, we have seen that transmission occur in the BWS case, where we did see very brief exposure transmit and then some amplification in the workplace, and then patrons impacted. But in other settings, this is a surprising element. Also, we have seen the speed at which a transmission happens in households, and I can't, but for my sense of it, the fact that those party, we haven't got any leeway here. To get on top of people's exposure venue within a couple of days of that exposure venue, you would hope that a proportion were not, that such a high proportion weren't infected. And what's also interesting is a number of people at this venue were actually vaccinated. None of the vaccinated ones have become positive, or to my knowledge. We're obviously interested in that into the future. But what I'm trying to say to you is that party, we've got such a high number of people infected at that party.
Would you call that party, Dr. Chant, a super spreader event similar to the Northern Beaches cluster? And just on that as well, given that it happened at Hoxton Park, and then people from that area have no doubt been out in the community for a day, as you suggest. Why is the Liverpool LGA not included in the list of areas for people that can't travel outside metropolitan Sydney?
So New South Wales Health has got the benefit of having public health units which are geographically based. They know the movements, they know the settings, they know the rapidity which we could get to the childcare centre. So for instance, the childcare centre, the exposure would have been on the Monday, we're getting them on the Tuesday. So telling people on Tuesday night. So again, very quickly and even quicker than a day earlier than we've got the party presenters. Clearly we also already had some protections in place in relation to mask wearing on public transport, and pleasingly this the person who attended the party, who did travel on public transport, wore a mask. So for all of those reasons, they give us the insights locally about their assessment of the venues, how much of a concern they've got, and they feel at this point that the exposures are manageable there.
And is that party is a super spreader event, do you think, under your definition?
Under my definition, I certainly would say that party was a super spreader. I think it's very important not to label individuals, as super. So I'm just cautious with the tone, but clearly having 10 people test positive in such a short time frame, and I would expect over coming days we'll be announcing further cases, because can I also stress this point? Close contacts need to be in isolation for the full 14 days. The reason we test you on the way in is because we want to find out if you were ever infectious in the community. That's the rationale for that first test. If that first test is negative, it doesn't mean tomorrow's test is going to be negative. And so you need to adhere to the isolation requirements, and you need the full 14 days. But the purpose of that early test is really to mop up any other community exposures.
Last question, please. Last question, please.
Premier, may I ask, yesterday when you walked into question... Sorry, when you walked in... Sorry, Dr. Chen, question.
Dr. Chen, just quickly, what do we know about the case who flew to New Zealand on that international flight?
So we know that person works in a health practice in the Bondi Junction area, and we know that person did travel on planes into New Zealand whilst infectious, and those were the subject of releases last night.
Premier, when you walked into question time yesterday, it was quite audible that you weren't happy with the level of mingling on the floor of MPs. As community leaders and community representatives, do you believe there needs to be more responsibility taken in Parliament to have this taken more seriously? I mean, there's a recommendation for them to wear masks in Parliament. There's not many people wearing masks right now. Do you believe more responsibility has to be taken?
Well, we've only just announced that recommendation for all workplaces, and I expect all workplaces to adhere to what we've put in place. They will be subject to a health order from 4 p.m. today. But obviously we ask everybody to take that advice immediately. We've only just presented that advice. Previously in workplaces we didn't ask people to wear a mask when they were going to work. Given the transmission rates of this variant, we are now asking that to occur, and I expect that in all workplaces, no matter where they are.
Do you believe MPs could be doing better though?
I think all of us can be doing better. Clearly this is a big threat to our state, a big threat to us being able to manage the pandemic in the way that we have for the last 16 months. So I'm asking everybody to please do the right thing. Don't cut any corners. Don't think that you're above the health orders or above the law. And it's really hard in some circumstances, but we're asking everybody to go that extra little bit to protect your loved ones, to protect your colleagues, and also to protect the community, because we're only as good as each other's actions, and all of us need to step up and take responsibility. It doesn't matter where you work, what your circumstances, and especially during school holidays, and especially during a time when people may have been intending to travel. So I just ask and appeal to everybody's good behaviour, good conscience. This is a very serious event, a very serious outbreak we need to deal with, and we are managing it without placing what we believe are unnecessary burdens on the community. But having said that, I am, and our government is open to taking whatever action we need to limit the spread and limit the transmission, and we'll be relying on health advice. And I'm the type of person not to worry about what people think. If we need to take action to protect people, we will, and if we need to change what we've announced today, we will. That all depends on the facts and the health advice, but what we're doing is providing certainty for the next week on the very minimum that we expect people to do, and if we need to take further action, we will.
Thank you, everybody.
Take, Premier?
Last one, please.
What further action will you take, Premier, on the government making sure there are no mistakes in and around the quarantine system when this whole outbreak occurred from, it started with one incident of someone doing the wrong thing or not doing what they should be doing.
Look, as I said, we need to get to the bottom of what occurred on this occasion. And as with previous examples, if we need to tighten anything up, we will. If we need to refine the health orders, we will. We always base our response on the facts. So as soon as we're presented with the facts, we'll act accordingly. Thank you.
Thank you.